there is always the possibility you want to build a relationship with a patient who you meet through clinical practice, or the fact that you're treating someone who's already a friend. What are the rules? What are the guidelines? How does it go in a court of law?
Well, firstly, it's not a possibility. It happens a lot. And this isn't just for chiropractors, I'm afraid. This stretches across many professions. But I have an
He means
abnormally
osteopaths as well.
osteopaths as well, forgive me. I have an abnormally high number of what I call sex cases, sexual misconduct cases, where there is a patient practitioner relationship, and that just I don't know why, but it is a high number. If you look at again at GEOS last year, out of the I think they had 13 professional committee conduct decisions. I think 4 of them were sex cases. So it does happen a lot. What are the rules? Well, the rules are very simple. Don't have a relationship with a patient. End of. If you are attracted to a patient, discuss it with your colleagues, discuss it with any mentors or any legal advisors that you might have, and say that this has happened. Don't discuss it with the patient. Definitely don't act on it. And if at the end of that discussion you feel that you can't carry on treating that patient because of your feelings towards them, you actually have a duty to stop treating them, but also to make sure that you don't make them feel it's their fault. So you have to find them another practitioner. You have to make sure that they're still looked after. But if you are found having any type of sexual relationship with a patient, whether it's full sex or whether it's going out for dinner and having a cosy chat in front of a fire and a coffee, you are going to be in trouble with your regulator, and it's considered probably one of the most serious breaches of the codes. People get struck off for it left, right and centre. So in terms of current patients, don't have relationships with them. It's that simple. If you, I think you said at the outset, you can't help yourself, there are some people that might fall in love with a patient. Well, that does happen. And I know some practitioners that are married to people that are their former patients, but you have to do it in the right order. The general rules are, if you see that happening, stop treating them. The next question is, can you have a relationship with a former patient? And there are guidelines and there are rules about that. And again, any lawyer worth their salt will say, well, don't unless you really, really, really have to, because that's going to come back to bite you. But you have to then start asking yourselves a whole series of questions. There's clearly a power imbalance between any practitioner and a patient. There's always going to be a power imbalance. And you have to ask, did this relationship get off the ground because of that power imbalance? Did I use my power to manipulate that relationship? What details do I know about this person as a patient? How long did I treat them as a patient for? There's a whole series of things that you have to think about. And if you want to look at the guidance, the PSA or the old CHRE, who regulate regulators, they've issued guidance. GEOS and the GCC have issued their own guidance on sexual boundaries with patients, and it's pretty clear that everything is steered towards avoidance. But if you really do find yourself in that position where you can't help it because that relationship has blossomed and it's come out of nowhere, stop treating them professionally, and really think hard and speak to colleagues about whether or not it's appropriate to continue seeing them, even when they are no longer a patient, and document those discussions, document the fact that you've thought about it, because the onus will be on you later to prove that you've gone through the motions.